Hello everyone, welcome back to my channel. So today we will learn about hydrocele. So first one is, what is hydrocele? A hydrocele is a medical condition characterized by accumulation of serous fluid within the tunica vaginalis, sac surrounding the testicle. It manifests as a painless swelling in the scrotum, often affecting one or both testicles. So in this picture, you can see there is no hydrocele present. This is a normal testicle, but in this picture when you see there is testicle and here it is hydrocele. It is said because even though there is no serous fluid that's seen, it's visible. This picture shows the swelling of the scrotum, that is hydrocele. So what is the cause of this? The origin of hydrocele can be diverse. It commonly results from an imbalance between fluid production and absorption in the scrotum, but trauma, inflammation or congenital defects can also contribute to this. Infections such as epididymitis may lead to hydrocele formation. So a hydrocele can be produced in 4 different ways. First one is defective absorption, that will be the primary cause. Second is excessive production, that is the secondary cause. Third is lymphatic obstruction, that is filarial. Elephantiasis, those things you have heard, right? So this lymphatic obstruction can cause to filarial. Then connection with the patent processus vaginalis, it may be due to congenital. So 4 different ways, that is primary, secondary, filarial and congenital. Then what is the pathology of this? Pathologically, hydrocele arises from the impaired drainage or increased fluid production within the tunica vaginalis. The fluid accumulation creates a sac, causing the scrotum to enlarge. The condition is often categorized as communicating, linked to the peritoneal cavity, or non-communicating, that is isolated fluid collection. So what is composition of hydrocele fluid? First of all, the color will be straw or amber colored. Second, the composition will be water, fibrinogen, inorganic salts, albumin and cholesterol crystals. The hydrocele fluid normally won't clot if it is drained into a container, but will clot immediately even if it is come into contact with a drop of blood. There are 2 types of hydrocele, primary hydrocele and secondary hydrocele. Primary hydrocele is caused due to defective absorption of the fluid, whereas secondary is caused due to excessive production of the fluid. Example, vaginal and infantile hydroceles. Here it will be caused due to filariasis, tumor, trauma and epidermolysis. It is big in size, but it will be attained in small. This is difficult to palpate testis. In secondary hydrocele, testis easily palpable. We can palpate it. In primary hydrocele, transillumination test is positive, whereas in secondary it is negative. The consistency is densely cystic, whereas here it is lax cystic. Here the treatment will be Jabolis and Lord's operation. Here the treatment will be underlying cause. Next is complication. While hydroceles are typically benign, complication may arise. Infection within the sac can lead to painful swelling, that is hydrocellulitis. Untreated hydroceles may enlarge, causing discomfort and affecting quality of life. The risk factors include testicular trauma, infections like epidermitis or filariasis, and congenital predispositions. Age may play a role, with older individuals more prone to developing hydroceles. The general management include initial management involves observation, especially if the hydrocele is small and asymptomatic. Scrotal support may alleviate discomfort. Addressing underlying causes such as treating infections or resolving trauma is crucial. The surgical treatment is persistent or symptomatic hydroceles may require surgical intervention. Hydrocelectomy, the removal of the sac, is a common procedure. The surgeon may opt for an open or laparoscopic approach based on the case's complexity. The homeopathic remedies that can be given is arnica, pulsatilla, hamamelis virginia and graphitis. That's all. Thank you for listening. Hope you like it. If you like the video, please like, share and subscribe.